Hi, I'm your host, Jeremiah Yang, the Administrative Director at the Hoag Spine Institute. Today, we're here to talk about something that impacts all of us at some point in our lives, back pain. Whether it's playing golf, tennis, doing yoga, gardening, playing pickleball, or even playing with your grandkids, the back is pivotal in being able to enjoy these things that we love to do. Now, the question is, what happens when that back pain just doesn't go away? Joining me today are two incredible specialists from the Hoag Spine Institute and the Center for Pain Management. Please welcome me in joining Dr. Kunal Sinha, a double board certified interventional pain medicine specialist, and Dr. Nathan Hahn, a fellowship trained spine neurosurgeon. Thank you both for joining us.
Thank you for having us.
You know, it's great that you were both able to spend time away from the clinic and come and join us to really educate our community here on how you can help address back pain.
We appreciate the opportunity. Thank you, Jeremiah.
Let's start with the basics. Dr. Sinha, what causes back pain in adults?
You know, Jeremiah, that's an excellent question. I really appreciate you asking that because everyone has this question. So for folks between 55 and 85 years of age, some of the most common causes of back pain are lumbar spondylosis, lumbar spondylolisthesis, spinal stenosis, degenerative disc disease. And I think most of the folks watching today have heard some of those terms, either in their friends or a doctor telling them those terms. One of the most critical things to understand about those terms is, as serious as they sound, they don't always necessarily confer a serious prognosis. And what I mean by that is a term like degenerative disc disease leads folks to think that their back is breaking down and that it's fragile and they can't use their back. And that's just not the case in the vast majority of folks. So one of the things I'd like our audience to know is that even if they have one of these diagnoses, under the proper care, the pain is just a signal that they need something taken care of and they need some guidance on how to use their back. And that's where myself and Nathan come in.
So Dr. Hahn, as a neurosurgeon, what is your perspective?
Yes, back pain is very common. We all have soreness or pain in our backs, but when that pain is lasting longer than 6 weeks, and you're having some tingling, numbness, or weakness of your legs, that's when I would think about something serious is going on and try to look for a specialist.
So it's not about panicking, it's about paying attention, being aware.
Exactly. Early management is the key to a proper recovery.
All right, well, let's talk about solutions. I
Sure.
think there's a lot of myths about back pain and back surgery that if you have back pain, surgery is inevitable.
Right. That myth is pervasive in the community and amongst the folks that I treat. And one of the first things I tell folks is that the treatment for back pain spans a whole gamut of possible interventions and solutions. I'll talk to you about some of them, starting from the least invasive to the most involved. So when I evaluate someone in clinic, sometimes I'm able to take care of their back pain without touching them with a needle, without prescribing a single medication, sometimes without even prescribing physical therapy. Simple things like modifying diet to an anti-inflammatory diet, modifying certain ergonomics or movements that they do in their everyday lives can eliminate their back pain. In most cases, a little bit more is needed to fully address their symptoms. That's when we prescribe things like physical therapy, acupuncture, in some cases chiropractic care, to treat the pain non-pharmacologically, meaning without any medications. Medications are, of course, in our tool belt as well, and we have many medications, not just opioid medications, which is somewhat synonymous, unfortunately, due to the opioid crisis with pain clinics. We have a multitude of very safe medications that can effectively treat pain and improve function. Now, if those measures don't provide the adequate amount of pain relief and, of course, functional improvement, getting back to activities like pickleball that you mentioned earlier, there are a whole host of interventions that we're able to perform right here in our clinic or in one of our surgery centers. And in the vast majority of those procedures, no preoperative clearance or anesthesia is required. They're done with local anesthetics.
Okay, so let me make sure that I understand this. So we're saying if you have back pain, you don't have to go to surgery. There's many other options from a interventional pain perspective. And if I want to stay active, would any of these procedures make it worse and make the pain greater, that I wouldn't be able to do the things that I love?
Well, I would be remiss to tell you or any of the patients who I take care of that any procedure that I do has zero risk. And one of the possible risks of any intervention is that there could be a flare-up of pain. I will tell you that in my experience, the vast majority of patients experience some degree of relief. The question is, how much relief do they get from these procedures? And in the small subset of patients who aren't able to adequately manage their pain or improve their function with the interventions that we're able to offer, I always walk over to Dr. Hahn's office, let them know that I'm sending them someone their way for a consultation.
Okay, so now I understand a little bit more about what conservative management is. That's everything that you shared. Well, Dr. Hahn, is there anything you'd like to add post-conservative management from a surgical perspective?
Yes, I am a neurosurgeon, but in fact, I don't operate on patients right away. I often recommend my patients to undergo all the non-operative management that Dr. Sinha just described, and only when their symptoms continue to persist or they're starting to develop neurological symptoms such as weakness, numbness, tingling in their legs, or if I clearly see on the imaging structural instabilities or lesions that does need surgical addressing, then I take the patients to surgery. This is why we work very closely with our pain management doctors, and our clinics are located in the same building to facilitate this intercommunication and provide the best patient care.
Okay. So let's shift gears a little bit, Dr. Hahn. Can we just expand a little bit more on when surgery is absolutely necessary?
Sure. Just like I mentioned before, when the pain continues to persist, or the common pathology that we see is severe lumbar disc herniations, pressing on the nerve roots, or severe lumbar stenosis causing neurological compromise, or structural instability, what we call lumbar spondylolisthesis, also known as shifting spinal bone. That's when I offer surgery to my patients.
I'm thinking about our viewers' perspective, and I think we keep hearing surgery, which probably can be very intimidating or even frightening. Can you walk us through what to expect post-surgery in terms of hospital stay or what that experience is going to be like?
Well, that's a perfectly reasonable concern for our patients and our viewers. Nowadays, there are minimally invasive surgical treatments for spine. So many of my patients, they're walking the day after surgery, and they're back to their light activities that they usually enjoy in about a week or so. Minimally invasive surgery involves very small incision, minimal tissue disruption, and are able to give the best, faster recovery rates for our patients after surgery.
So is there an opportunity then post-surgery for someone like yourself, Dr. Hahn, and Dr. Sinha, for you guys to work together?
Absolutely.
Yeah, so I think one of the hallmarks of our practice and our enterprise is that we don't have two separate independent practices that don't communicate with each other. It's not enough that you have an interventionalist and a spine surgeon involved in your care. You need those two specialists to be communicating frequently and often throughout the day. And that's one of the things I most appreciate about working with Dr. Hahn, is that I can always knock on his door if I have a question about whether a patient is appropriate to refer to him, and he always does the same with me. We work collaboratively on every single case.
In fact, we recently shared a patient together where the patient went to see Dr. Sinha, and Dr. Sinha recognized that the patient's symptoms have been deteriorating at a faster rate and ultimately needed surgery. So he referred the patient back to me right away, and we were able to see the patient the next day and found out the right surgical treatment that the patient needs and is on the schedule for fast treatment.
Right. In an era where medicine is so fragmented and there's lacking collaboration between physicians, it's really rare to have the opportunity to see a multitude of doctors who interact so well like they do at our spine center.
Yeah. It sounds like an amazing benefit for our patients that both an interventional pain management doctor like yourself and Dr. Hahn, a spine neurosurgeon, can work together and collaboratively take care of our patients. You guys are obviously putting patient care at the forefront, and that's amazing.
And when you need surgery, they don't have to fear, because there are minimally invasive methods out there that can get you back on the golf course or the pickleball court, sooner.
Well, This has been very helpful for our viewers, and there are three main takeaways from this conversation. First, don't ignore persistent back pain. It's common, but not something to brush off. Second, most back pain doesn't require surgery. There are many effective options available. And last, when surgery is needed, today's techniques are smaller, safer, and faster to recover from. Before we go, any final words from either of you?
So Jeremiah, I just wanted to echo your sentiment about seeking care early for persistent back pain. Now, we can never ignore red flags or neurologic issues or any emergency symptoms that might lead you to see someone like Dr. Hahn sooner rather than later. But those cases are the exception, few and far between. For the vast majority of chronic back pain, it can be managed safely and effectively with the conservative measures that myself and my colleagues in the interventional pain department can provide to our patients under proper supervision and guidance.
And if you do need surgery, there are minimally invasive techniques that can cause less pain, faster recovery, to get you back on the golf course and the pickleball court sooner than later.
That's great. Thank you, Dr. Hahn, Dr. Sinha. Thank you for your expertise today.
Thank you.
Thank you for having us.
If you or someone you love is experiencing back pain, please come see us at the Hoag Spine Institute and the Center for Pain Management. Thank you both.
Thank you.
Yeah, thank you.
My pain all started with pain in my legs. Very, very emotional because you get to a point where, depending how bad your problem is, you can't stand up.
It's hard to watch somebody in pain all the time. It's kind of separated a lot of activities that we used to do together. I'm doing them alone. I don't know why I'm so sorry.
I love bicycling, walking. I love pickleball. We stay very, very active. When you can't do that because you can't walk, you can't do anything, and you find yourself sitting, and it's the worst.
The MRI demonstrated severe spinal stenosis. So spinal stenosis is compression of the nerves. You'll see that right here, there's a tight narrowing of this spinal canal. So his nerves that are traveling through this spot are getting compressed.
God, you're walking. You're walking. You're walking. With no pain. Amazing.
In Dan's case, we were able to provide a minimally invasive surgery, get him back on his feet quickly, back into recovery, and back to the sports that he loves.
Words can't express
Yeah. Thank you.
you. Unreal.
Yeah.
The feeling. How do you express that? You know,
You gave him back his life.
that's right. He gave me back my life.